Penile Implant Surgery. Your questions and answers. Brought to you by FixED, www.fixed.net.au.
ED, or erectile dysfunction, is the inability to get a normal erection. Most men will find that as they age, their ability to get a natural erection becomes more and more difficult. Sometimes younger men may find this condition can present quite unexpectedly. Erectile dysfunction has a variety of causes. Probably the most common thing is just getting older. There's circulation trouble throughout the body, and that can affect the penis. And as that happens, the penis is unable to get an adequate circulation to maintain an erection. Other conditions like diabetes, blood pressure, even cholesterol levels can affect your risk for erectile dysfunction, sometimes other illnesses, and possibly even medication that you may take. Treatments are wide and varied. We generally look at medications that may be causing the erectile difficulty, and if we can't find anything in particular, then we often will try a medication. The three most common ones are Viagra, Cialis, and Levitra. They work in different ways, and your doctor can advise you which one they think may be more suitable for you. Certain types of heart conditions make it difficult for you to use these tablets, and it'll be worth checking with your doctor which one may be suitable if appropriate. Once tablets are tried, if they are appropriate and perhaps they don't work, then we tend to move on to two other types of treatments. One involves a vacuum erection device, and this is a device that you place over the penis, create a vacuum within the penis, and then place a ring at the base of the penis to maintain the erection that's been caused by the vacuum device. It's not all that popular, but a lot of men will try it just to see what they think of it. Following that, we tend to try penile injection therapy, where we use a very small needle like the ones used by diabetics to inject themselves, and we teach you how to inject a small amount of medicine directly into the penis to get a very reliable erection. And that would work in most men in about 90% of cases. If injection therapy doesn't work and the vacuum erection device doesn't work, then we often start to consider whether you will need a penile implant. This is high technology surgery where a number of urologists would be able to perform this, and it's worth finding out if your urologist performs this surgery regularly. This device is placed usually through a small incision just above the penis or down in the scrotum. It's a three-part device, and you can inflate it by a small device that's placed within the scrotum that you can feel, and by pumping that, the penis will inflate. When you complete it, sexual activity, you can deflate the device by the same pump within the scrotum. In terms of satisfaction rates, the tablets as a group work in about 60 to 70% of men across the board. When they fail, then you try vacuum erection devices. They would work in about 20 to 30% of men. The injection therapy works quite well in up to 90% of men. However, the problem relates to some men just not being able to inject themselves and just not being comfortable with the whole idea. Penile implant surgery, once you get there, if it's appropriate, is generally very well received. More than 85% of patients, as well as their partners, will be very satisfied with penile implants. Penile implants, once you get comfortable with the idea, are a very suitable way to treat erectile failure. One of the huge advantages of penile implants is that they are reliable. They've been around for a long time, they've progressively been improved, infection rates now are quite low, and the surgery, when done by someone who does this type of surgery regularly, is relatively straightforward. You're often only in hospital for one night, sometimes maybe two. What I tend to find is sometimes men will be able to try the tablets but don't seem to move on because they think the treatments are getting too complicated. I'd certainly encourage you to talk to your GP, and preferably a specialist who deals in this area, about the other treatment options. What I generally find is once a man can get comfortable with the idea of the other treatments, particularly penile implants, they tend to find a permanent solution to their problems, and they're very happy with the outcome. The main thing is to explore the options and consider them without suffering in silence.
Penile Implant Surgery. Your questions and answers. Brought to you by FixED, www.fixed.net.au.